Good afternoon and welcome to United TV. My name is Kemal Erkan. Today is October 18, 2024, our Bariatric Friday session with Dr. Isaias Irgau. Dr. Irgau is here in the studio with me. Dr. Irgau, how are you?
I'm doing great. It's a pleasure to be back again, Kemal, for another session
It is our pleasure.
Bariatric Friday.
So I was talking to a couple of my friends the other day, and they're like, how do you actually make the surgeon come to your studio every week? So
We make it happen.
it's not, we are not taking that for granted because we know that you have to make an effort to do it, and we appreciate that. So because if we are speaking on really important healthcare issues, coming from a physician surgeon, that has a huge meaning and value, and we appreciate because of that. Thank you for being here.
Of course. Thank you.
We are going to discuss maintaining weight after bariatric surgery. So, one of those where, as people get used to easy things. And I think because it's so efficient, bariatric surgery is a tool for morbid obesity. So things can be very easy, and some of us may not really understand how quick we lost so many weights, so much. So because of that, the whole process is under a program, and we do this with CRIAS and American Surgery Center. And part of that is, hey, from the beginning of the first visit to the surgery and after surgery, there's certain things that we want you to follow, because this is a big decision. This requires a lot of changes that we need to make in our life. And what we have done so far is not working. Definitely now we have surgery. We lost 100 pounds, and we want to keep that. So that's where we're going to need your help.
This is an extremely important topic for us bariatric surgeons, because when we do bariatric surgery, we are performing a treatment that will allow a person to really become healthy for the rest of their life. So our goal is a long-term goal. It's not a short-term weight loss. It's a long-term healthy life with adequate weight loss. Clearly, there are changes that we make when we do the surgery. Those changes are extremely important changes and provide the patients with a powerful tool for them to lose weight significantly, right? But there are other things that we do not change and we cannot change. One of them is the environment where the person lives, right? Mm-hmm. We live in an environment which is extremely encouraging for anybody to gain weight at any time, right? There's plentiful of calories in terms of food availability, and also the lifestyle that we conduct really is not one that encourages physical activity. Mm-hmm. That environment is where the patient goes back to after they leave us, right? After the surgery. So that hasn't changed. The other thing that hasn't changed also is that the basic biology of our body, which is a biology that encourages weight gain. As we've talked other times in our session, our body, the way it works, it actually does not know how to lose weight. It was never made to learn how to lose weight, because that losing weight never had an advantage for our survival during our evolution. It was a body that was really purposely made to gain weight, right? So that hasn't changed either. So with these facts in place, when we send the patient back after the surgery, we also have to empower them with tools that will allow them to constantly fight this tendency for the weight to come back, right? That is why there has to be long-term education about importance of lifestyle changes in terms of how the patient eats, what they eat, when they eat, in the long term, the level of physical activity, but also certain important aspects of mental health challenges that can come up from time to time that could sabotage, right? So we have to be extremely knowledgeable about this and transfer that knowledge to our patients as well when we educate them. So the first thing we tell them, as you know, and we've said in this sessions, is that bariatric surgery is not a magic wand, right? It is a tool. extremely powerful tool, but nevertheless tool. And as any tool, the person who uses that tool has the power really to determine the outcome, right? And education, therefore, is extremely important. Now, that education has to come also with long-term follow-up, and that follow-up is important. That's why we say to our patients that they are patients for life for us. You know, unlike the patient that comes to me to have their gallbladder removed or their hernia repaired, the patient that comes to me for weight loss surgery is a patient that I will be carrying with me for the rest of their life, right? They have to follow up forever for us. So that is extremely important.
So, like, how often do you see the patients coming back with their regaining weight? Do you see a lot?
So I would classify weight gain in two types, right?
Mhm.
There is a patient who regains some weight over time, right? They may regain maybe about 5% of what the excess weight that they have lost. So the patient may come up maybe with 10 to 15 pounds rebound over time, right? That is still a manageable weight, right? For a person who's lost 100 pounds, if they regain 10 pounds in the long term, they will still be 9 pounds below what they started, right? The weight gain that really concerns us is significant weight gain, right? So if a person, for instance, has lost 100 pounds and then they regain 60 pounds, 65 pounds or more, that is very concerning. Now, fortunately, the patients who end up in that category are a minority, maybe about 10 to 15% female patients, right? The vast majority of patients actually are able to maintain excellent weight loss in the long term after bariatric surgery.
Sure. So now, someone who also is in our case conferences on a daily basis, we see patients first time coming for a consult. Sometimes more than once after a year or 18 months they come back. This is before surgery, so they just couldn't go through the surgery and then they come back, and then almost 9% of the time they gain weight anyway. But then now we are actually on this topic, we are talking about someone who already lost and almost achieved to be where what their ideal weight is. And then they picked up maybe some of the things that we are telling them not to do. They picked up some bad habits, or like the holiday season is coming. So I already mentally prep for that. So I'm going to have my boiled eggs before any of the events that I go to, and then I'll have 3, 4 of them, the egg whites, and then I'm okay. So in our Christmas parties, I don't eat. And the only reason I'm able to do it is because I prep for that. So now we want to make sure that patients understand that the tool works, but then after you get to where you are, what you do with your body is all up to you. So we don't want to be going back to where we were before, and therefore, this is really important to follow all the direction that we are giving them. Dr. Irgau, one of the issues that we see time to time again is the nutrition deficiencies. So how important nutrition is, I know we discussed in different times as a single topic, but for the weight gain, this also has an impact, right?
Absolutely, absolutely. So what the patient will be adapting in terms of their nutritional habits is very important, not only to avoid obviously weight gain in the long term, but also to avoid certain medical problems that could arise due to nutritional deficiencies, right? Particularly with procedures like gastric bypass or the duodenal switch, where a large portion or a long portion of the small intestine is bypassed. Those people are at risk of being nutritionally deficient, particularly from the point of view of vitamins and other micronutrients. So patients have to take certain vitamins on a regular basis. They have to be able to choose certain foods that are rich in micronutrients for them. So they cannot just take calories, empty calories that do not have any nutritional value to them. They have to invest on nutritionists that will enrich their nutritional status as well. So not only is this good for them, but it can actually create health problems in the long term if they don't do that, right? To some extent, even patients who've had the sleeve gastrectomy or even the band could also be nutritionally deficient if they don't take the necessary vitamins, if they don't focus on nutritionally very rich foods in the long term. So that is obviously very, very important.
So you and I, we didn't have bariatric surgery, right? So you take your daily vitamins,
Absolutely.
and I take my daily vitamins,
Absolutely.
and everyone I talk to, I make sure that they take their daily vitamins.
Yeah.
So this is not about the surgery itself, but it's just like it's even more important. So I think we will be okay if we don't take it for some time, but the consequences for those who have bariatric surgery not having enough nutrition can be it can have a different negative impact on the body. So hopefully patients are following that.
Yeah,
Again, like anyone at a certain age, because you explained this in our single topic sessions on nutrition, malnutrition, especially where, from what we eat today, we're not getting the nutrition. Like it's not like fresh or like a lot of them are already processed. So what you should be getting is not what it is. So therefore, the gap cannot be closed by eating more. It's just like taking the right vitamins to close that gap. So that's probably that simple. But I still see people not understanding that. But maybe if they were to go back to our nutrition specific ones, they can actually even learn more, because I get like B12 shots every month. And like I don't have any disease or anything, so I still do it. So
the consequences for somebody who's had bariatric surgery and not taking vitamins, the necessary vitamins or macronutrients, can be dire. Obviously, there are the readily visible things like hair loss, weakening of bones, the skin becoming brittle. But there are more serious problems, like, for instance, nerve damage. And sometimes the nerve damage could be irreversible. So these are very serious problems that have to be taken very seriously. And one way, obviously, of making sure that that doesn't happen is to be compliant with your vitamins, but also to have a regular follow-up with us as well. One of the things we do, for instance, is that we do blood work that is broader than the blood work that people may have when they see their primary care doctor for their yearly visit, because we will be including levels of important vitamins as well. And sometimes we may find that patients actually may need even additional doses of vitamins that they may be taking, from the regular vitamins they take over the counter. So this knowledge is extremely important. We have made some changes to the digestive tract that put these patients at risk of becoming nutritionally deficient, and regular follow-up, and also adhering to the guidelines and to the education that we give them about taking vitamins on a regular basis. It's very important.
So I want to give a different example on the vitamin issue. Even someone who had a hair transplant, the surgeon will say after they got enough hair, they still need to be on certain supplements to make sure that the process is not like they're going to lose the ones that they have, they not, but they're going to lose the ones already there. So they need to support that. So they have to take vitamins. But we are talking at a much greater level here, where this impacts the impact on this one and on the entire body. So and it's simple. Like I have one of those pill boxes, I guess. It's a pill box. So we put Monday through Sunday. Easy. You go there in the morning, you take them, and you're done.
Schedule, right?
Right, schedule. Like you need to make it easier. You don't need to put too much effort. You just need to be organized and make sure that it's there when you need to. So it's like when I go to Turkey, I have the bigger pill box, and that I get like 2 weeks worth of stuff already filled, so that I don't have to worry about when I'm going to take.
Absolutely.
So these are, I mean, we can make things more practical and make it easier. Now, I personally believe one of the most important issue on the regaining weight after surgery is as much as all the other things that we are talking about, but the exercise is a huge factor, and many people don't really understand what we mean by the exercise. We are not asking people to go and spend 2 hours at the gym, but we want them to move, right? So, and it requires certain effort, and you have to remember. So, can we actually talk about the lack of exercise and how that impacts the regain weight?
Absolutely. This is very, very important, critically important. So, as you say, the foundation of all exercise is really movement, right? You have to be able to move. So, people have to ask themselves, what is my day life? Is it sedentary or is it active? In other words, I get up from bed and do I go to a chair where I stay there for hours on end? Or am I active physically? Right? And that depends really on the person's occupation, right? Some people will have jobs where they transfer from their bed to the chair and they will be on the chair for a long period of time and then they go back to bed as well. That is an absolutely sedentary type of life, right? Other people may actually be more active because their job, their occupation may be physically engaging. So they will be active. So the person who's active physically in their job actually has an advantage because that type of lifestyle actually is extremely healthy, which means that the person whose occupation by definition is sedentary, they have to take extra steps to be able to stay active, right? And this means that they really have to be conscious about the times that they are spending sitting down. One of the ways for them, for instance, to manage that is, to count their steps. And nowadays we have the technology that allow us, people can wear a smartwatch or even just utilize their own smartphone. And as long as they have it on them, that smartphone actually will track their movements. Now, what we would like to see, I take patients that ideally I would like to see them walking about 7,000 steps a day, right? That sounds like a lot, and it may be a lot. But if one starts tracking it, they may be able actually to achieve it.
It's not. I'm going to tell you.
Absolutely.
Because the goal for me is 10. And you and I, we discussed this, and I try to kind of do certain things to see if I can actually relate to what our patients are going through. It's simple. It just needs that extra effort to say, hey, I need to do this. I need to remember doing it, and once I remember that our phones are other smart devices, it tells you how long we are sitting, how many steps we are already taking. So I'm just going to give you an example. Like even this new office.
Yep.
So from the studio is on the opposite side of my office. So and I make an extra effort to walk, and we are right next to the kitchen here. So then I'm making an extra effort to walk from there to here. In fact, I was telling Anne the other day, I have my confirmation and all that in my office. I said, maybe we should put them in the studio so then when I need it, so that practical, it may not be so, but I like the idea of, okay, that's going to give me, if I go there twice extra, that's at least, 1,000 steps. So it's like those efforts, like when you leave here, I try to come with you to the parking lot. That's another 700 steps. So it's not that difficult. It's the mindset. And, the other thing that people, from the accountable care side, on our United Medical side, what we see with this fitness and exercise issues and people with hypertension and other chronic problems, they don't understand that they're, like the hypertension-related issues with the peripheral things, with circulation, that goes through your legs, right?
Absolutely.
Well, if you sit all day long, and if you don't make that movements, then you are going to actually it's going to be worse. Yeah. I think there's some understanding issue, like when Dr. Wasif, when he does procedures on the peripheral leg, that's all on the legs, right? So it's got nothing to do with the heart. it opens the blockages. Like that happens because they don't move.
Yes.
So it's that simple.
Yes.
Like I tell my mom, like she doesn't leave the house a lot, and she has someone who's helping her. She's independent. I mean, the things, but she doesn't want to leave her house. I'm like, no, you have to move because what you do in the house is not enough. So she lives in a gated community, so she can go downstairs and walk around the neighborhoods. No problem.
Absolutely. Absolutely.
They okay. So it's raining. So then there's the garage. Go and then walk in the garage. Well, it's cold. Go to one of the shopping centers and then walk in the mall. So this is easy. It's just like mindset, right?
It is. So the key essentially is to have that awareness of tracking it on a daily basis. As you said, if you track it on a daily basis, then you can tweak your day, your daily living, the next day to add more steps, as you mentioned, for instance. Absolutely. If there are certain activities that you can do that will increase the likelihood of movement, then you do that. Obviously, if you're parking, for instance, the intuitive thing that for people to do is to find the closest parking spots, right?
Oh, I
People
can
fight
complain
for
about
it,
that.
right?
So if he's watching, Sean Donovan, who was here earlier,
Yeah.
so I park, I think one level or like half level, and I park in the farthest point of the parking lot.
Yeah.
And it gives me that extra step. So,
Absolutely.
and then I see his car closer, and then it's like one level up. He's taking the elevator. I'm like, and the other day we were leaving together for Lisa Rochester's event, and he's like, he went to the elevator. I'm like, what the hell are you doing?
Yeah.
So I need my steps. So he's young, of course, so he's going to probably work out at some point. But those are the things. I mean, if he was someone who had morbid obesity, but he's his BMI is probably 25, 26, right? So like he's a professional or college football player. There's no issue for fitness, but the mindset of that with someone with morbid obesity is a problem.
Absolutely. So those tracking of your steps on a daily basis is important. And of course, we do want patients to incorporate other activities as well. For instance, resistance training is very important, not only to get their muscles to become strong, but also to make sure that their bones are strong. Make sure that they do balance exercise, make sure that they do that stretching exercises. All those are important, but the foundation has to be movement, right? They have to transform their daily living from a sedentary to an active one. And awareness is obviously very important for that.
Absolutely. Now, what about the family and support groups and the friends that we hang out with? How much impact they have?
Huge impact, because if you are in a nurturing, supportive environment, you will thrive, obviously, right? Because you're emotionally supported. And if you're emotionally happy and content, the chances are that you will stay focused, right? In fact, the times in which I see patients coming back after bariatric surgery, sometimes it could be as far as 12 years after bariatric surgery, and they would come back to me and say, okay, in the last year, I regained 50 pounds, right? And they struggle before they come and see me because they feel really ashamed of the fact that has happened. Well, almost invariably, there will have been some type of crisis in their personal life that has triggered the emotional or stress-related eating, essentially, that would lead them to that situation, right?
Sure.
So having that, supportive environment around you is very important. And of course, it is clear that crisis can happen. Even if you have a very supportive environment, sometimes things can happen, losing a loved one or getting divorced or losing your job or things like that can happen, right? So having in place mechanisms that will support you are important, because if you're not aware of that, it's very easy to slide into stress eating or emotional eating, which is a vicious cycle that is very hard to come out from, right? Because you feel, and then obviously when we are in that kind of cycle come out, we actually reach for comfort foods, the foods that are absolutely terrible in terms of our health, but also the ones that will encourage weight gains, right? So people reach out for those foods because they want that instant gratification,
Right.
get away from that emotional situation, from that stress. But obviously the food will give them a little bit of comfort for a little bit, but the stress and the emotional problems will stay, which will trigger another bout of eating, which is devastating because then they will find themselves gaining weight, and that by itself will make them stressed and emotionally unhappy. And it's a vicious cycle that really leads to a very, very difficult situation. So
Absolutely.
that I see very often. And one thing I really counsel patients on is that the minute you feel that you are struggling, come back to us, right? Yes, we want you to come back and tell us that you're successful, to celebrate with us, and we're very happy about that. But we are far more interested in you coming back when you feel you need support, right? In our office, our staff, our psychologists, our nutritionists are here to support people when they are struggling. So environmental, stability, in terms of relationship, in terms of, their life situation is very important for them to stay focused in the long term. And when they feel that they're struggling in these areas, they will start struggling with weight regain as well. And it's important that they reach out to us at that time.
And I think one last thing that I want to mention, Dr. is, being able to, monitor not only the intake, but also the exercise. This includes sleep schedule for many people. Not everyone needs an 8-hour sleep, but some people do need more than the others. But so this is so simple. I show this all the time. And I still have Monday through Friday intermittent fasting, 16 to 17 hours every day. But one important thing here is step averages from last year to this year. So it says I'm 1,000 steps higher than last year on average. So if this is the other way around, I know that I would have been right. And you actually know that I'm doing better this year than last year because you know what I do every day. Even if not every day, I kind of keep you up to date with that on Fridays. So it requires that understanding and commitment. So it's all here. So it is not because you have morbid obesity. It's for me, it's for Dr. Irgau, it's for Sean, it's for Alp, it's for Anna, it's for Susan. So whoever is watching it, so then we all have to make decisions and we have commitments. And I know it can only get better once the commitment is fully registered in your head. So and then all the other things are going to be, it's going to follow what we do, what we decide, and things actually will be a lot better. So they just need to keep watching what we have. So Dr. Irgau, thank you so much for joining us again.
Thank you.
We'll be back with another topic next week. And we did have, last week we had Dr. Yelvin, who was with us, discuss the sexual well-being, but we focus on the menopause as 85% of our patients are female. So we want to cover that with a female physician, and she did a great job last week. And as always, you coming back, it's we always appreciate what you guys are doing for us. Thank you.
Thank you. Thank you very much. Appreciate it.